Good morning, good afternoon, good evening. It's really great to be here, and a big welcome to this discussion. My name is Stephen Hoffman. I'm the director of the Global Strategy Lab, which is based at York University in Toronto, Canada, and the University of Ottawa, also in Canada. Today, we're just really excited to be partnering with GARDP, the Global Antibiotic Research and Development Partnership, to bring this discussion to all of you today, focused on assessing opportunities and challenges for addressing the global challenge of antimicrobial resistance through the draft's negotiated pandemic instrument that's currently being discussed among member states of the World Health Organization. We all know that the COVID-19 pandemic has been a really terrible experience for this world. Over 15 million people estimated to have died during this period, more so than would have otherwise without that pandemic. And when we think about this pandemic, of course, it's a terrible experience. We need to, though, as people, be looking at systematically what are some of the silver linings in the kinds of new institutions that we can build to make our world more equitable, more sustainable, more resilient to the future kind of threats that will come our way inevitably, whether that's from things like climate change, whether that's things related to war and security, whether that's related to antimicrobial resistance, which itself is already responsible for over 1 million deaths each year, and which could itself be one of the sources of the next pandemic that might come our way. And so this conversation is timely. There's ongoing negotiations about how the world can work together to best prevent, prepare for, respond to the next pandemic. And so as a result, we've brought together a really stellar panel of folks today who are going to be able to share some of their words of wisdom, but also take your questions. So we've reserved a lot of this webinar really for you, for everyone in the audience to share their ideas, as well as to pose any questions that they might have for this great group. And so with that in mind, just before I introduce the group, definitely familiarize with this interface. There is a Q&A, a question and answer button at the bottom, which is available for you at any time to ask your questions. And that will form the major part of the second half of this discussion period today. And so with that, let me just launch right into introducing our discussants so that we can get right into it. First, let me introduce you to Rohit Malpani. Rohit is a policy consultant for GARDP, which is our co-host today. So thanks so much, Rohit. And Rohit, you're also a board member at Unitate, representing non-governmental organizations, which is really fantastic. And then next I want to introduce Otto. For many will need no introduction. He is the founder and senior advisor of REACT, Action in Antibiotic Resistance, and he also holds a senior professorship of infectious diseases and antimicrobial resistance at Uppsala University in Sweden. And indeed, Otto, just before this event, you were REACT was hosting a webinar with several ministers of health on exactly this issue around how do we leverage any discussions around a potential pandemic instrument to advance antimicrobial resistance. So the fact that there was that webinar and your ability to participate here today is just a really nice alignment, so that we'll be able to hear right away what happened over there to inform today's conversation. And then finally, Susan Rogers van Katwyk is an investigator and the research director for antimicrobial resistance at the Global Strategy Lab, as well as the managing director of our WHO Collaborating Center on Global Governance of Antimicrobial Resistance. I won't do any further introductions, but I will just then point it over to you, Susan. You're going to help us kick off about an 8 to 10 to 12-minute presentation highlighting the key issues. Rohit, you'll be going next, and then Otto, I'll turn to you. Susan, over to you. Thanks so much.
Wonderful. Thank you so much, Stephen. And let me just find my share screen button here so I can kick us off this morning. There we go. Can I get confirmation that that looks good from everyone? Perfect. Well, I am absolutely delighted to be speaking today about opportunities and challenges for addressing antimicrobial resistance through the negotiation of a pandemic instrument. I think the COVID-19 pandemic has really laid bare the shortcomings of current global health security arrangements, as well as clearly demonstrating that no single country can address global health threats alone. And so now we're at a moment where attention is really shifting towards ensuring better preparedness for future disease outbreaks. And as a result, we have this moment to re-examine and coordinate and strengthen global governance arrangements in order to better mitigate the human and economic and social toll of future disease outbreaks. And I think at these moments of reflection, it's really important not to fall prey to recency bias and to recognize that not all pandemic threats are going to resemble COVID-19. And so as the WHO Intergovernmental Negotiating Body prepares to draft and negotiate an instrument for pandemic prevention, preparedness, and response, it's really important to critically consider the full range of substantive issues that should be addressed within that pandemic instrument to ensure adequate global readiness for the next pandemic, whether it does look like COVID-19 or a different kind of pandemic threat. And we are faced at the moment with not one, but two urgent pandemic threats, both zoonoses and antimicrobial resistance. So while zoonotic diseases are estimated to cause 3.3 million deaths a year, and COVID-19 will cost the global economy over 12.5 trillion through 2024, we also have AMR, which, unlike acute disease threats, is an ongoing evolutionary process that really requires continuous management. And this can make AMR appear to be a slower moving challenge than many zoonotic infections. But as Stephen's mentioned off the top, resistant pathogens already kill more than 1 million people a year and have huge impacts on human and animal health and well-being, with particularly devastating consequences for marginalized populations. And so while zoonoses may play a role in the next pandemic, comprehensive pandemic preparedness really has to involve planning for all the potential pandemic sources, including both zoonoses and AMR. And yet, at the same time, current discussions of a proposed treaty have really focused exclusively on zoonoses. The inclusion of AMR in those discussions has been a very recent addition to the conversation, I would say really in the last few weeks. And yet taking that narrow approach can really severely limit our ability to prevent and prepare for and respond to the pandemics of the future. And it's particularly important to see these two pandemic threats side by side because small tweaks to a pandemic instrument could really address major AMR challenges. And while there are certain provisions specific to pandemics of each type, for example, provisions to prevent zoonotic spillovers or to manage antimicrobial runoff in the environment and to fight falsified drugs, the actions that are needed in order to address zoonoses are actually very similar to those that are needed to address AMR. So not only is there a strong rationale for including provisions to address AMR in a pandemic instrument, but AMR can be included within the scope of a pandemic instrument synergistically and for greater impact. And so there's an important opportunity here to make progress on pandemic preparedness in the face of both of these urgent global health threats, because the core capacities for mounting an effective response to AMR and other global health threats are extremely similar. So for example, investments in research and development could be hugely helpful in generating new tools and opportunities if they're applied with the lens of developing vaccines, diagnostics, new drugs for both AMR and future pandemics that are of zoonotic origin. Similarly, assisting other countries by scaling up access to vaccines, pooling procurement for essential goods, or through different kinds of training and technical assistance will have profound equity impacts by reducing the inequitable consequences of both AMR and other types of pandemics. Harmonizing surveillance systems, conducting global risk assessments, and sharing data samples and sequences will also speed up the global response to any new AMR or pandemic threat, allowing as much as possible for us to get out ahead of emerging threats. And so all of these are areas where it makes sense to align AMR and pandemic prevention efforts through the new pandemic instrument. And there are sort of three areas in particular where zoonoses and AMR have overlapping needs and for which dual purpose provisions could really lead to greater impact. And the first one of these would be a provision to ensure equitable access to countermeasures. So medical countermeasures, antimicrobials, diagnostics, personal protective equipment, and vaccines are vital for controlling the spread of infectious diseases, including zoonoses and AMR. But the extent to which they can be effective really hinges on access to those tools, which in turn will depend on their development, their validation, their regulatory approval, their manufacturing, and then their distribution around the world in an equitable way. And many of the countries most impacted by global health threats are also among the poorest, making it challenging, if not completely unrealistic, for them to bear the full financial burden of a pandemic alone. So a pandemic instrument could designate antimicrobials and diagnostics, personal protective equipment, and vaccines as global public goods, and create or adopt trusted mechanisms for expediting their development, ensuring their availability when they're needed, and then funding their efficient procurement and their equitable distribution. And embedding a process or a provision like this within a pandemic instrument could really harmonize emergency regulatory approval processes as well, speeding them up and supporting the development of regional manufacturing hubs that would produce these specific goods. There's also an opportunity, instead of reinventing the wheel here, for pandemic instrument negotiators to leverage existing mechanisms like CEPI, CARB-X, and GARDP by officially incorporating them as part of the global pandemic response strategy and scaling up financial support for them to ensure medical countermeasures are available and equitably distributed. And then lastly, the similarities in the kinds of financing strategies needed for both types of pandemic threats really further support the development of strategies that simultaneously tackle both. For example, one of the prominent proposed mechanisms to finance new antimicrobial research and development is the D-linked subscription model, which is very similar to COVAX, the advanced market commitment mechanism used to finance the scale-up of the COVID-19 vaccine. So putting these mechanisms in a place via a pandemic treaty is both a first step towards meeting key AMR needs, as well as an important mechanism for quickly ensuring equitable access to these countermeasures in the face of other future zoonotic pandemics. The second provision where AMR and zoonoses have overlapping needs is in terms of ensuring One Health surveillance and monitoring of infectious disease. So surveillance is fundamental to effectively managing a global pandemic response. And in both AMR and pandemics, we frequently see new challenges arising at the human, animal, and environment interface, where surveillance is key as an early warning system that allows for information sharing with policymakers and with researchers in the face of emerging variants of zoonoses and the spread of new resistant pathogens among both humans and animals. So in order for a One Health approach to surveillance and monitoring to be effective, it must be globally integrated to facilitate that transfer of knowledge and data on new infections, to activate public health responses, and to guide decision-making at both the domestic and the global level, as well as to inform research and development efforts towards new global public goods. And that lack of knowledge sharing has proven to be a barrier to action in the past. But a pandemic instrument in this case could mandate the implementation of minimum One Health surveillance and monitoring capacities that go beyond sort of monitoring established and expected infectious disease threats to include capacity for monitoring the emergence of those potential infectious disease threats, be they zoonoses or new resistant strains of bacteria. Including this kind of provision in the pandemic instrument would also provide an opportunity to mandate the development of standardized protocols on data reporting and knowledge sharing, as well as an opportunity to create a new One Health regulatory body that would be able to develop technical standards related to One Health issues, including AMR, to better facilitate work at this human-animal environment interface in the future. And then finally, zoonoses and AMR both really require increased technical and laboratory capacity, and would each really benefit from provisions in a pandemic instrument that enable greater international cooperation and financing for capacity development. So all countries need trained personnel and lab infrastructure, including the physical space and the equipment, to undertake One Health surveillance and monitoring. And yet in many low and middle income countries, there are constraints, including the limited availability of highly qualified technical staff, such as lab technicians, epidemiologists, and data managers who can manage these systems. And there are also fewer clinical laboratories and diagnostic facilities in many LMICs to conduct laboratory testing for antimicrobial resistant organisms, other infectious pathogens, and that exacerbates the barriers to participating in that globally integrated surveillance and monitoring system. So to address those challenges, a pandemic instrument could really promote technical assistance and knowledge sharing among countries and encourage financial support to enable LMICs to meet those minimum One Health surveillance and monitoring capacities. Around the world, all governments would also benefit from inclusion of a mechanism for developing and sharing international best practices on laboratory testing, again, with provided support to LMICs to build capacity for newer technologies such as genomic sequencing and wastewater surveillance. And then a pandemic instrument could also mandate the implementation of joint external evaluations of both surveillance and lab capacity, as well as support for prioritizing limited lab capacities during times of emergencies. And these kinds of provisions would be necessary to retain and increase technical capacity in LMICs in order to scale up surveillance and monitoring and enable that full participation in the globally integrated One Health surveillance and monitoring system that's needed for both zoonoses and AMR threats. Taking action within this pandemic instrument to safeguard antimicrobials really serves two purposes. The first is that it reduces the threat posed by AMR, a massive achievement in itself. But second, it preserves an essential resource for responding to future pandemic threats, as the treatment for many zoonoses really relies on antimicrobials to either reduce the severity and death from secondary bacterial infections. So even if the next pandemic starts from cross-species transmission, the treatment will rely on access to effective antimicrobials in many cases for hospitalized patients. And for example, had they been available, antibiotics could have saved countless lives during the 1918 flu, as the majority of deaths likely resulted from secondary bacterial pneumonia. And we've seen that antibiotics have been similarly important in treating secondary bacterial infections in COVID patients as well. And so it makes sense, therefore, to include a couple of key provisions specifically designed to safeguard the effectiveness of antimicrobials. For example, provisions to promote antimicrobial stewardship and to protect the effectiveness of existing antimicrobial medicines would be strengthened by their inclusion in a pandemic instrument. And a pandemic instrument could also develop a regulatory framework governing the use of antimicrobials in a sustainable, acceptable, fair, and effective manner. And that framework could govern which antimicrobials should be accessed, watched, and reserved in healthcare in line with WHO's AWARE framework, and which critically important antimicrobials should be limited to human use. And while these are core actions for managing AMR, they offer massive benefits for pandemic preparedness in general. So addressing the full range of future pandemic threats really offers the best protection and the best use of resources. It's important that while we evaluate the lessons learned from COVID-19, we don't stay narrowly focused on zoonotic diseases at the expense of other pandemic sources. COVID has offered us this unprecedented opportunity to evaluate the ways in which we approach global health threats under global health law, but early discussions that have remained narrowly focused on zoonotic diseases really aren't enough to encompass the full scope of challenges that we face ahead of us. And so the goal of a pandemic instrument is to ensure that there's a comprehensive framework to prevent, prepare for, and respond to future global pandemics. But it's taking that broad approach and including both AMR and zoonoses that offers the best chance of being adequately prepared in the face of future infectious disease threats. I will stop there and hand it back to Stephen. Thank you so much, everyone.
Great, Susan, thank you. Brilliantly walking us through, I guess, the case for making sure to address antimicrobial resistance in any potential pandemic instruments, honing in on not only that zoonotic zoonoses and AMR are both natural sources of potential pandemic. A lot of the issues that would need to be addressed for both sources are actually very similar, and the unique opportunities through potentially international law to address some of these dimensions of AMR that otherwise would not be opportunities. So thanks so much for that three parts and that clear case. I'm also seeing, just before I turn to Rohit, just seeing that the questions are starting to come in. That is great for folks who are attending live, as opposed to hearing this afterwards as a recording. Please do help us out, share your questions that you have throughout the time. And with that, let me though turn it to Rohit Malpani, who is from GARDP. Thanks so much, Rohit. Over to you.
Thank you. And let me just get the slide started here. So thanks a lot. I really appreciate the opportunity for GARDP to be able to co-host this and to join this discussion today. I think at an important moment in the development of pandemic treaty. So just by quick introduction, GARDP is the Global Antibiotic Research and Development Partnership, which is a not-for-profit partnership that seeks to develop new antibiotics to deal with the most serious bacterial infections, within a particular focus on late-stage development and responsible and sustainable access. So this kind of, I think, already echoes a lot of what we were just hearing in that great presentation in terms of why we need to be thinking more about drug-resistant infections, even within the scope of something such as COVID-19 and fast-moving pandemics. So first, that, I think as already was laid out, we are very much in the midst of a crisis with drug-resistant infections in terms of morbidity, mortality, and that it's very much a silent or a loud pandemic, I suppose, that spreads easily within and across borders. As I think was just mentioned, timely access to appropriate antibiotics is a critical component of preparedness and response to future viral pandemics. And as we saw during COVID-19, there was a significant spike in antibiotic prescriptions early in the pandemic, which may or may not have been related to actually addressing what we're presenting with, and have led to some concerns with misuse and overuse of antibiotics. About 18 months ago, GARDP, we came out with a publication that tried to look at some of the lessons that we were already seeing with COVID-19, and some of which have ultimately remained as both concerns and sort of cautionary tales for the future. I think first that really early investment in research and development of new treatments and vaccines is both necessary and cost effective when one looks at the financial consequences. And certainly with drug-resistant infections, we have very good visibility of what's already required, but not necessarily the political will and the financing to meet the need. Secondly, that as we've seen in COVID-19, we've had both good examples and bad examples in terms of collaboration and international coordination, and I'll come back to that. We knew in the run-up to COVID-19 that traditional market incentives are not adequate to ensure the development of medical countermeasures. In the years leading up to COVID-19, although coronavirus is already seen as a global health threat, there was neither the public nor private investments to ensure that we could respond effectively. That ultimately equitable and affordable access to medical countermeasures was and is necessary for response. And then inequity to access to medical countermeasures, which has been very much a feature of COVID-19, is not only a tragedy in terms of its consequences for countries that have been on the wrong side of the vaccine divide, but ultimately undermines our trust in the international system. Now, I bring that up because I think, one of the things that the presentation and the publication does is speak very clearly about the technical requirements that are required to address AMR in a future pandemic instrument, and we would agree with all of those. But I think we certainly also think that there's a need to think about the political components of this. The first being, and again, that we saw in COVID-19, that low and middle income countries were often treated in the COVID-19 pandemic more as beneficiaries than as equal partners. And that very much undermined having a comprehensive and equitable global response. So any pandemic treaty or any other mechanism or means to address AMR or any other pandemic threat needs to ensure that these countries are partners and again, not as beneficiaries. Secondly, that, I think we were mentioning both in the last presentation and in the publication, the role that COVAX and the ACT Accelerator played, which were both useful, but not necessarily fully effective, or were necessary but not sufficient. And this is very much because voluntary solutions often do not meet the true needs for all countries in a manner that is equitable and ensures access. And so very much a pandemic instrument offers a great opportunity for us to move from mechanisms and means that are voluntary to ones that are actually mandatory and ensure that we have fairness in the end result. And thirdly, I think very importantly, the publication talks about the importance of global public goods. But what we've seen in global public goods cannot just arise through a hope that there is this practice both from the public and private sector. And what we've seen is that we need to have R&D funders, whether they're in the public or the not-for-profit sector, to set out rules and norms for preparedness and response that can translate into equitable access to countermeasures. And again, that's also something that a pandemic treaty can help to institutionalize and to ensure that we have coherence amongst the many different funders of countermeasures, both today and in the future. Now, just to talk about some of the specific interventions with research and development and access, which is ultimately where GARDP is focused. First of all, we have to recognize where we are today with research, development, and access. We have a significant shortfall in funding and resources and really dedication towards the needs that we already need to see today. So not only are we facing the challenge to ensure that we can place AMR squarely within a new pandemic treaty or pandemic preparedness and response, but in the meantime, we also know that there's a lot that needs to be done to really, again, increase the investments that we need to make and to make sure that it is sort of not the poor cousin in the future also, as we look to have a more sustained response. I think secondly, it's not just a question of how much funding, but ultimately for what it's provided. And certainly one of the challenges with AMR is to the extent that most of the funding for research and development comes from a few countries. There can be a challenge in terms of which priorities are ultimately going to be set and whether or not they're going to focus on the greatest unmet needs, or if they're ultimately going to focus on the specific priorities of high-income countries. And again, that's something that a pandemic treaty hopefully can address is in terms of really creating a predictable and fair process for priority setting. And certainly one area that's of great concern to GARDP in which we invest significantly in is around the needs of children and especially neonates. Thirdly, we do think that research and development should be a transversal topic. So it's not a standalone topic within pandemic instrument, but it's one that really needs to go transversely across an entire pandemic treaty. And that's really to ensure that we are trying to approach the development, access, and stewardship of countermeasures on an end-to-end approach so that we have consistency and coherence across the entire life cycle of a new or existing product. And then finally, I think we have to think carefully about whether or not the rules or the norms that are being set up for pandemic preparedness and response are going to be synergistic with funding. And so, for example, right now, on the one hand, we have discussions at the WHO around the new pandemic instrument. And on the other hand, we have the creation of a new financial intermediary fund that could finance a lot of this response and could be managed by the World Bank and by, perhaps the G20. And we need to ask ourselves whether or not we're going to have coherence between these two, and really if the norms and the spending priorities ultimately align with each other. This is, again, just to emphasize the importance around children and neonates, which has always been underrepresented in antibiotic development. So, for example, in 2017, only 2 out of the 37 new antibiotics that were under development for adults were actually being studied in children. And this is a concern that we have going forward to make sure that, again, we're setting priorities for all populations and not just simply for adults. And then just as the last slide, we thought the publication did a very good job to talk through some of the issues in terms of ensuring sustainable access and stewardship. 3, I think, that were identified in the publication was around manufacturing, which of course was a major issue in COVID-19, both previously for vaccines and to some extent currently, and now as we're also seeing for antivirals. So certainly ensuring that we have sustained manufacturing at a time in which shortages for antibiotics are growing is important. We agree of the importance of having pooled procurement as a means both of creating predictability for public and private manufacturers of antibiotics, but also to ensure that we can accurately pool demand and ensure that there's equitable access. And then certainly the importance of health worker training to be able to prepare and respond quickly as new drug-resistant infections emerge. We did want to highlight 2 additional areas of access and stewardship that are worth considering. One is certainly the licensing of intellectual property. So one thing that we've seen in the COVID-19 pandemic is a failure to have sharing of intellectual property can often lead to concerns around both affordability and supply. And certainly for antibiotics, having a licensing of intellectual property with the right standards in place is a means to ensure that we can meet supply and also ensure affordability while preserving appropriate use. And secondly, as we all know, registration of antibiotic continues to be a major concern. So hopefully any pandemic instrument can, really ensure that we're creating the right pathways to have rapid registration in all countries around the world. And I will stop there.
Great, Rohit, thanks so much. Another fantastic presentation, in this case, highlighting again the opportunity, but also some of the challenges in how any pandemic treaty could be developed if done if just a repeat of the way that we responded to COVID-19 pandemic, and then highlighting on the specific issues based on the experience of GARDP. So thanks so much for that. We're now going to go right into discussion. And Otto, I'm going to, if I can get your help to help kick us off, would love to just pose really the first question to you, which is really around, what do you think of all this? You've been in this area working, you've been a global champion for addressing antimicrobial resistance for decades, founder of REACT, the leading civil society and advocacy organization built around addressing antimicrobial resistance. You just hosted a webinar with several ministers of health. Otto, tell us, what are your thoughts on all of this and how do we go forward? Thanks, Otto.
Thank you very much. I haven't prepared any slides, but I'll try to walk through a few comments that I have scribbled down during the excellent presentations from Susan and Rohit, and also allude to a little bit to what happened in the previous webinar. For sure, we are in a crisis. Antibiotic the death toll is increasing, antibiotic use is increasing, the pipeline is not sufficient. So we are really seeing this opportunity as a must happen thing to enter. And obviously from the webinar we had together with South Center, we had some strong voices from the South, from Gambia and Zambia specifically, that were clearly saying this, that we want to push this through. We need to have an AMR included into the new pandemic instrument. It's an absolute must. I'm amazed about the level of engagement that these countries, with the struggle with the financing and the capacity they have, but still they're working tremendously much on the broad scale and on a multi-sectorial way. But they need something more from the global perspective. We at REACT has been working for 16 years now. We still focus on antibiotic resistance because it's really the bacterial pandemics we see. Bacterial pandemics are ongoing, not future. We have seen them for pneumococcus, for MRSA, and now particularly for the gram-negative species around us. And the death toll, as you know, specifically with neonates and small children is tremendous, staggering really. So from that on, why did it take so long for the global community to react? I mean, but that was a strategy already in 2001 from the WHO, strategy to contain antimicrobial resistance. It wasn't funded, it wasn't implemented. It took until 2015 when we had a global action plan. I think at least three things, which are still unfortunately true, is the issue is non-tangible. It's not a disease. It's difficult to find narratives, and moreover, people have been relying all the time for the pharmaceutical industry to deliver new drugs when the old one is worn out. And this is not happening. So we have lost a lot of time to understand the dimensions of this crisis. We have worked together with you and others over the years to try to push organizations like the WHO for taking the lead for a binding, legally binding instrument, and we had also the Global Development and Stewardship Framework for some time that was moving forward, but was then silently stopped. We have the political declaration from 2016 in the UN, which has not delivered on all the commitments. So it is really time. And again, I think that we have some strong voices and some strong actors from not least from Africa that will help driving this into the pandemic instrument. I am more positive now than I was half a year ago. Now, if you read the zero draft, or what is called on the AMR, antimicrobial resistance is mentioned there. And all what you have been writing up in your excellent paper, I agree with most of it, really. I still think that I like to counteract or contrast rather bacterial versus viral pandemics, because I think the bacterial pandemics is really what we need to push for, and access to effective countermeasures for that threat, including for sure and new antibiotics alternatives as well, and not the least bacterial vaccines, and not the least diagnostics, because what the COVID-19 taught us, COVID-19 was, the research took a quantum leap during the COVID-19. Without diagnostics, we would not have been able to cope with the pandemic as quickly as we had. And the problem with antibiotic resistance is that we don't have that diagnostic tools at all. I mean, we were more or less blind. The prescribers are blind in many countries. We have no guidance at all. So coming to the components that we might think should be and must be included, for sure, I think also prevention is there. Prevention, strengthening health system, water and sanitation, infection control is an element without which we will fail.
Yeah.
R&D, absolutely, an end-to-end approach. I'm not sure that the subscription model will fix everything. I think we need to have more push in incentives as well, because people really don't understand how difficult it is to really make a new drug, and how difficult it is to get potential molecules driven through the early stages of the pipeline. So I think that is something that there need to be some global agreement, financing, capacity building, and collaboration across, maybe even a global institute like CEPI for antibiotics. It's urgent, and the bits and pieces in this whole chain is not really fitting well together yet. No. Surveillance, absolutely key. I'm soon done. Surveillance is key. Early warning, also fragile. We really don't know when and how a new genetic event could happen in the environment or within an animal-human context, and we need to have systems to pick it up so that we can prepare for a new bacterial threat.
Also, you mentioned prevention. Can I maybe, if this is an opportunity, I'd love to grab a couple of the questions from the Q&A, because I think I'd love for, maybe if I can put the question to you. There's a couple of questions from Isatu Sar, who is based at the London School of Hygiene Tropical Medicine's MRC unit in the Gambia. If I can merge those questions together, Isatu, I hope I do it okay. It's really about talking to the underlying things that are allowing resistance to be accelerated, and that's insufficient focus on prevention, whether that's prevention, for example, by not having sufficient healthcare system resources that can limit the spread of AMR, for example, in a hospital setting, or whether it's about antimicrobial use, for example, on the farm. Otto, I know in the draft, or the zero draft, an outline of the pandemic instrument that's been prepared, there's lots of discussion about prevention, or at least an identification that prevention issues would be there. But we also know from past treaties that kind of thing, that's where the fluffy content is, where it's platitudes, but not really the resources or the requirements where other things are. Any thoughts, Otto, about the role that prevention can play, especially because it seems like a lot of the same actions to prevent the next zoonotic pandemic are the same as to prevent the next potential AMR fueled pandemic. Otto.
I'm sure that the others have a lot to say as well. I mean, absolutely, this is key, and prevention is always difficult. Clean water and sanitation is the key factor. Just have a look at what happened during COVID-19. We had distance, we had masks, we stay at home, and we didn't get sick. There were no other viruses spreading, and hospitalization for infectious diseases went down except for COVID. So Absolutely, and I think what is missing, and this is not only for WASH and for IPC, it's for conservation of antibiotics and as well. It's really about target setting or some measuring, monitoring, set steps, because what we need to see is that the systems need to be stepwise improved, like climate change. I mean, we need to have a capacity building fund or some financing for capacity building and system strengthening in both the health, the animal sector and environment. But that need to be moved according to some standards and goals and targets that are transparent, measurable, and where governments are accountable, including WASH. How many facilities in low-income countries lack water and sanitation, running water? I think it's about 40% in the lowest settings. I mean, we need to put that up so that we can measure the improvements underway. And for sure, outbreaks in hospitals, in the community as well, could be prevented. Yes.
Great, Otto, thanks so much. I'm going to go to the next question. Claire Chandler, I see you are here. You're here in person. Claire, maybe instead of me asking the question for you, I wonder if behind the scenes we're able to get you on so that you can ask the question with audio yourself. Claire, are you there? I think you are.
I am. Can you hear me?
I can hear you. Claire, thanks so much. Welcome.
Thank you very much, and for running the event. Very helpful for those of us who are less familiar with things like pandemic treaties, and excellent presentations. Thank you to Susan and Rohit. So as someone working as an anthropologist, seeing how people use antibiotics in practice, I've seen how critical it is to have surveillance data locally to inform which antibiotics not only aren't working, but the ones that are still working. I'm seeing, increasingly this heightened concern that there is AMR and therefore these drugs don't work anymore. And that is obviously something we do not want to be perpetuating. That would be an inadvertent backfiring of raising awareness. So I'd be really keen to know in what ways, because you all mentioned about surveillance being part of the treaty, in what ways can a treaty help to ensure that AMR surveillance occurs in order to meaningfully inform practice locally, in terms of the resources and capacity that is required to enact that? What's the pathway for change from the treaty to people having information to help them make antibiotic use decisions?
Susan, I wonder if we can turn that really good, but also tough question to you.
Yes, it is a really good question. I see a few different pathways. One of them absolutely needs to be around standard setting and trying to get surveillance systems integrated. At the moment, so many of the surveillance systems don't speak to each other. Whether that's country to country using different standards in terms of what counts as resistance or how the math is adding up, or whether that's sector to sector. And not knowing that your surveillance in your agriculture sector has found a problem that you should be on the lookout for in your hospital-based surveillance programs. So I think getting that standards piece is right, getting that integration so that systems are able to talk to each other, remembering that many of these surveillance systems are still someone with an Excel document or even just a piece of paper trying to keep track of all of the case counts and things coming in. I think that one's really key. And then I think the second piece needs to be around the technical capacity and making sure that there are enough people who are trained who can look at the data and pull out meaningful bits of information from that to be able to share locally. I think one of the other pieces that flows from that is just the need to communicate what the data is showing. So often, surveillance becomes an exercise and kind of sitting on the data. And then a few years from now, when it's time to renew guidelines, we think about what the data is telling us. But getting that more real-time information where people aren't being passively sort of fed a new guideline and expected to keep up, but where they're being actively told about local conditions and how they might need to change practice to, account for that is really, really important, just for making sure that people can, in fact, act on all of this data that's being collected.
I see that because this that works so well, Claire, and thanks for your willingness to come give your question in person. It changes, it's a nice dynamic. Let's see if we can do this one more time, if the IT will work. Raman, thanks. I see your question about patent waiver, but instead of me asking it, Raman, if the technology works, maybe I can turn it over to you to ask it live. And I think Rohit, you'll probably be the best person to answer. Raman, are you there?
Yes, can you hear me?
Yes, we can.
Okay. So good evening to all of you, especially my two mentors, Stephen and Susan. I'm very happy to see you. And the discussion presentation given by my mentor Susan and also Rohit, it was absolutely fantastic. And in this regard, I have a question. That you know that the pandemic in the past and also in the present, it's due to actually microbes, either bacteria, virus, or parasite. So we need antibiotic or antiviral to tackle to combat this pandemic. So now you know that the medicine, most of the medicines, the innovator is in the developed country, and our third world country, our middle income country, we only copy the drugs, that is antibiotics or antivirals. So as per WTO TRIPS agreement, the least developed country, they will be able to manufacture, they will get this patent waiver up to 2032. And after that, they will not get this patent waiver. And for middle income country, they will not get any patent waiver. So those countries who are graduating now, say they will get this patent waiver up to 24 or 26. Afterwards, they will not get this patent waiver. So the speaker, you had been talking about this accessibility of this antiviral or antibiotic. If this low and middle income country, they cannot manufacture this medicines, or especially the antiviral and antibiotic, then the appropriate antibiotic and antiviral will not be utilized in those countries. They will utilize other antiviral or antibiotic which are not effective for that particular disease. So more that AMR will produce in that case. So I think that this patent waiver issue should be included in your strategic plan. That was my concern and question also. Thank you so much.
Rohit, any reactions?
Yeah, sure. So I mean, a couple of things to note. The first just being, while the architecture of research and development traditionally has been, as you say, about companies in the global north and sort of the copying the global south, it is important to recognize that there is a lot more research being done both in the public and private sector in the global south. And that's something that GARDP is very much built upon. We just signed a partnership and collaboration agreement with Bugworks, which is a company based in India. And we also have a lot of partnerships with the Indian Council for Medical Research, as well as other governments to conduct research and development, as well as to run clinical trial networks. So I think certainly the hope has to be that we don't just have this model of from one part of the world to the other, but we really have a collective approach in which all countries are contributing to research and development and ensuring we have equity. I think the second thing to note is, the recognition has increasingly been that intellectual property is not an effective incentive to pay for the development of new antibiotics, because they need to be conserved and they need to be affordable. And so there is less commercial incentive, at least through traditional means, to invest in research and development. And that's why we've seen a lot of new potential incentives emerge to help pay for research and development, both that involve push funding as well as pull funding. And I think to the extent that we are relying upon those means and mechanisms, we should be ensuring also, therefore, that we are setting conditions in place that ensure that we can have equity and affordability around the world. So one of the things that I think GARDP strives to do, both through its agreements as well as through its discussions with governments, is not only to see more funding coming into research and development, but also to ensure that we are building in these conditions at the front end to ensure we have equity and access. And then on the back end, where we still see these problems emerge in terms of affordability and equity, that we are trying to push for licensing conditions that can improve access. As an organization, we haven't taken a position around the potential for a waiver to emerge in the future, but we know that there were discussions just held at the World Trade Organization And I think the clearest thing we can state is that intellectual property very much has to be discussed as part of a pandemic instrument, because it does play a role in both in terms, again, of whether or not we have the right incentives in place that may not rely upon intellectual property to develop new countermeasures, and also whether or not we can ensure that there's affordability and equitability once a new countermeasure comes onto the market.
Great, thanks, Rohit, and thanks so much, Raman, for letting us, well, for you to say, not only ask the question, but doing it live all the way from Bangladesh. Bangladesh, much appreciated. We're now going to go into more of a rapid mode because I see we have only 6 minutes, but quite a few questions. So this will be my challenge to the panel to try to react as in concise cannonballs of good ideas. My next question, I'll go, maybe Otto, if I can turn this one to you. We have a question from Anand Balachandran, who is based at the World Health Organization, the unit head for AMR National Action Plans and Monitoring, a brilliant leader I've had the chance to work with. Anand asks, Otto, can the treaty include provisions to strengthen accountability for the implementation of AMR National Action Plans and Health Security National Action Plans? Do we need a joint external evaluation mechanism for monitoring AMR National Action Plans? Otto, any reactions to that?
Yeah, the short answer is yes, but with conditions. Because I think many countries have, most countries have national action plans. Many are hampered by the lack of financing and technical human capacity, and it need to be coordinated. And the fact that is not happening because the AMR focal point has other duties, just percentage over time, need to be recognized. But I think that target setting and commitments need to be taking place, and it is so, and also. But in parallel, like again, the climate change, we need to have some transformation fund to transform systems and strengthen systems underway so that we don't put the burden of every country. No, the rich countries need to help, and the rich countries need to take responsibility for the global common good. So I think again, monitoring, accountability, target setting is the way forward, but we have to be very sensitive to the needs of the low-income countries.
Thanks so much, and thanks for that great cannonball of an idea. Thanks, Otto. I love this question from Rahila Ahmed, who's based at City University of London, and with Cedric at Wellcome. Rahila, you ask us and I think Susan, you might be the best person to address it. She asks, at the national level, how will the instruments capture baseline capacity versus the ability to scale up any response? So really talking about pace. We saw that in many high-income countries where we did have the former, so we had some baseline capacity, but the latter in terms of process, so scaling up in terms of process, was a major failure. Susan, any reactions to that? It's certainly, I guess, the ability to scale a response, definitely relevant for AMR, relevant for pandemics, much to be potentially addressed in an instrument. And that's one of the big goals. Susan?
Yeah, very, very much so. I think one of the key things here is that a lot of the underlying capacity needs to look the same. And so to the extent that we can build capacity that can be used as surge capacity in the event of a COVID-19 like emergency, but also during times where that's not the case, can really be devoted to ongoing AMR surveillance and working on stewardship and all of these other things that need to happen in the long term. I think we have to be careful to balance the fact that AMR is long term and will continue to be long term. It will continue to need to be actively managed. And so we can't let every other global health emergency pull the focus off and pull the teams away. But at the same time, I think we do also have to recognize that building capacity in general will give us more surge capacity for future emergencies.
Great, thanks, Susan. Rohit, we're going to direct the very last question to you. That question comes from Jyoti Joshi, who is an AMR advisor with ICARS. Jyoti talks about how many resistance mechanisms will develop in low middle income countries, which may not have the resources to detect and address and actually mitigate the development of those resistance mechanisms. And that what we have seen actually in the COVID-19 pandemic is that when countries do identify a new threat. In the case of COVID, it was, for example, new variants of concern. There's all sorts of stigma and discrimination that countries then face as a result of very helpfully identifying and letting the world know about these new threats as they are emerging. And also without then the benefit of getting access to solutions that could actually help mitigate those threats that those countries very courageously and amazingly helped identify for the world. Rohit, as the final word, any reactions or thoughts? Over to you.
Well, just I think that the problem lies in conceptualizing this as one, any pandemic treaty or instrument is response is one in which the so-called global north is seeking to protect itself from the global south. This is ultimately something that it goes back to the point that all countries have to see this as something that they buy into, that is setting the rules, that ensures that there isn't stigma attached, and that ultimately whatever investments we make benefit everyone equally. It really just comes down to how we set the rules, how we engage in governance, so that this isn't seen as one imposing on the others, but it's really done on a consensual basis. And arguably that has always been the problem, at least with the COVID pandemic, is it is seen as one set of actors acting upon another instead of seeing it as being one that benefits all of us.
Rohit, thanks so much for that final word. I'm going to thank the whole panel now. Much appreciated for the time that you took today to share these thoughts. A big thanks to the team behind the scenes that made all of this possible. And of course, to all of you who joined today's discussion, either live or joining afterwards, watching the recording. We very much appreciate it. It's been an honor here at the Global Strategy Lab to be hosting this with GARDP, the Global Antibiotic Research and Development Partnership. Looking forward to seeing all of you and continuing this conversation about opportunities to address AMR through a potential pandemic instrument. Be well and all the best. Thank you very much.
Thank you.